Dear doctors, welcome to the world of energy-based medicine. Here I would like to discuss with you about the diagnosis aspects of the headache in terms of traditional Chinese medicine. How do we diagnose in general? See, in energy-based medicine, we don't need a laboratory report. We no need any scan report, no need of an X-ray, no need of an MRI. You can diagnose the individual based on the intensity of the pain, time of the pain, how the duration of the pain. So based on this, we can diagnose. We will go through how we can apply our diagnostic skills in management of headache. There are three main patterns from which you can diagnose. The first one is a diagnosis according to the channel. The second one, diagnosis according to the type of pain. The third one, diagnosis according to the amelioration and aggravation. We will discuss the first one, the diagnosis according to the channel. See, we have the head, the meridian flow. If you look at the head, this forehead, which is a brighter yang side, and the posterior head, the back of the head, is greater yang side. The lateral head, which is lesser yang. So when the patient are suffering from a pain, if they complain and if they come and tell you about the pain in the forehead, which is a brighter yang, if the pain in the lateral side, which is a lesser yang, if it is a pain in the back side, which is a greater yang. So brighter yang, greater yang, and the lesser yang. Occipital headache is the greater yang headache. Frontal headache is the brighter yang headache, and the lateral headache is the lesser yang headache. And majority of the people, they will have the form of pain across the head, and sometimes they'll have the pain, especially the vertex. The vertex is a deficiency pattern, either because of blood deficiency or indeficiency, which causes the pain. So the vertex is liver blood deficiency, deficiency of qi and blood, heart and blood deficiency. These three patterns can cause the vertex nature of a pain, the central head pain. The sides of the pain, which is due to liver yang excess, the lateral side of the pain due to liver yang excess, this fall under the pathology of yang excess pattern. The yang, when the yang is exceeds, there are three sequential steps which happen at the liver phase. When the liver yang is rising, that the wind will be an agitated nature of a wind, and that wind became more heat and that consumes a lot of yin. This kind of a headache is a throbbing, intense headache, which is lesser yang side. People will have sometimes the headache around the eye. This around the eye headache is related to liver blood deficiency and liver yang rising. Primarily it is because of the spleen, qi, as well as the liver qi defect. Liver yang is not enough to uprise to the head. And most of the pattern, the forehead, which is absolutely due to stomach qi deficiency, stomach heat and dampness and phlegm. Majority of the people will have the habit of skipping the breakfast, because when we are going to the office or when we are going to the school, we don't have a time to have a food patiently in the morning time, and we are highly urgent oriented people. So due to urgency, we may skip the breakfast, or many of us will have a habit of taking a coffee in the morning. When you take empty coffee in the empty stomach, and when you skip your food in the breakfast in the morning, that tend to induce your earth deficiency, which means a spleen qi deficiency as well as stomach qi deficiency, and that causes inducing stomach heat. That is the reason for your forehead pain. And the back of the area, the occipital area, there are three reasons by which the occipital region gets aches. When you expose too much of AC, or when you are traveling during a windy season, or when you are traveling in a cloudy season, that time the wind can directly affect on the posterior aspect of the head. So that condition is known as back of the head occipital form of headaches, which is due to a external pathogenic factor, and there are other factors like the kidney yang deficiency. Kidney is not able to support, and sometimes damp heat in the bladder, which causes, like people with stroke, people with cerebral palsy, people with lot of palsic syndrome. The ophthalmic region, they'll develop a lot of viscous secretions in their eyes. Those kind of people, due to excessive coldness, which causes headache, those kind of headache or occipital region, the reason behind is kidney yin and yang defect, liver yin and yang defect, plus bladder heat. So these are all the main pattern which involves in the headache. You have to screen the individual. You have to assess whether the patients are, what frequency they have the pain, what is the intense they are having pain. The whole head pain, as we said, it is kidney yin deficiency, essence deficiency, and the invasion of external wind. Diagnosis according to the pain. You can differentiate the pain. Feeling of an emptiness, dull pain, feeling of heaviness, stabbing pain, pulling pain, and distending pain. So you have to sit with your patient, probe them clearly what kind of a pain they have. Based on the pain significance, pain duration, you can diagnose the individual. When there is a dull pain which is related to a deficiency pattern, when there is a feeling of an heaviness which is related to dampness or a phlegm pattern, distending pain which is related to liver yang excess or a liver fire, stiff pain is due to wind cold or liver yang invasion with a chronic defect, pulling pain is internal liver wind, feeling emptiness which is related to kidney deficiency. So the first pattern of diagnosis we have diagnosed according to the channel. The second pattern of diagnosis we are diagnosing according to the nature of the pain. Third pattern of diagnosis according to amelioration and aggravation. You have to find out when the pain is in the daytime, which is related to deficiency of qi and deficiency of yang. When the pain at night time, which is due to deficiency of a blood or a deficiency of yin. When the people are doing an activity, if a person is doing activity, the pain is getting worse during activity, which means they'll have a deficiency of qi or a deficiency of blood. When the patient feel better at rest, during activity the pain is worsening and they're feeling better at rest, this is also again a deficiency of qi or a deficiency of blood. When they have a feeling of a better with a light exercise, which is liver yang rising or a phlegm, when they have too much of pain during lying down position or at rest, that is due to dampness or a phlegm. So based on this time of the day and activity at rest or worsening at rest, you can differentiate the nature of the pain and you can understand the pattern which cause a headache. So dear doctors, this will help you to diagnose better, and different weather conditions like extreme hot weather which causes liver yang, liver fire rise up, extreme winter season which will causes a deficiency of yang, and extreme cloudy season which causes dampness and phlegm. So these various seasonal fluctuations also can cause. So your responsibility as an energy based physician, once you started to discuss with your patient, you have to patiently listen the word from their mouth, understand what is the nature of the pattern, and briefly you examine the patients about their pattern and select the point. So based on this, if you select the point, the patient's recovery will be 100%. We'll meet you again. Kindly do subscribe this channel and share this video to your friends and relatives. Thank you.